Step 1, PPE step, have your gloves on, gown, mask, and eye protection. I'm just gonna have gloves on for today. Step 2 is to have your equipment out. I have it all laid out here to my left. Step 3 is the first preparation stage. What you're gonna do is you're gonna get a 10 drop per minute IV tubing, open that up, locate the end of it, this lure lock, and you're gonna cut it just before the second lure lock so that you have a lure lock on the end and a cut piece of IV tubing. Next part, you're gonna grab a 2.5 millimeter pediatric ET tube and disconnect the ET BVM adapter and place it inside the cut end of your IV tubing. It's gonna be a little tight. We need it to be tight so the air pressure will go through without popping it off, and you're done with that. Step 4, further preparation. You grab your 14 gauge decompression needle and your 10 cc syringe that we wasted 8 cc's out of, and you attach those like so. Next, prepare your patient supine position in the sniffing position so that the airway axes are aligned. Locate your site. You have the thyroid cartilage superior, cricoid cartilage is inferior, in between is the cricothyroid membrane. You're gonna locate your site. Remember, it'll be more difficult in pediatrics. Clean your site, circular motions, get your IV start kits out while that dries. Locate your needle, uncap it. Use your patient's face as anchor points. We're gonna go at a slight angle. We know where our site is, we have it there. We're gonna insert at that 45-degree angle just until we break the skin. Once we break the skin and the bevel is inside the skin, we're gonna aspirate. We're aspirating bubbles, so we know that we're in the trachea. Lower your angle just a hair more and insert your catheter into the trachea and dispose of your sharps. Next, we're gonna grab our lure lock BVM adapter that we made and attach that to the catheter, like so. And then you're gonna take your BVM and attach it while maintaining control because we haven't secured it yet. And then we're gonna verify our placement by giving breaths. So we would have somebody listening for lung sounds. We have air moving in the lungs, condensation and end-tidal CO2 on the monitor so we're knowing the right place. Next, we can secure it with a tachyderm, like so. That just goes over that entire attachment to help keep it in the right place. We would have a C-collar on our patient. Once we have verified its placement, we can then secure it to the face and we're able to start ventilating our patient.